So I'm going to talk about just the three-tiered nature of our governmental public health system. And I am excited to have worked in all three levels of governmental public health. And so one of the things that's been really important to our three-tiered system is to ensure that there is redundancy at each level. So there's the federal level, the state level, and local level of public health. And the goals of all three levels are to assure the public's health, assess health conditions and concerns, and to develop public health policies. And it is important that all three levels have these same goals, because if any one level of our public health infrastructure were to fail, we don't want all of public health to fail. And so in the event that, let's say, the federal level is not able to do its job, we still have the ability to assess the public's health at the local and state level. But when you have three levels that have the same goal, the question is always going to be who's on first. Who's supposed to take charge in the event of emergency? Who's supposed to take charge in the event of a crisis? Who's supposed to take charge over the population's health just in normal times? But the Constitution has been really clear on this and set it out that the health of the population is largely the function of state and local governments. The federal government totally has a role here, and their role is to work at the national level to assess the nation's health, to come up with recommendations or health priorities, set national standards, and also really work to support the work that is being done at the state and local level. And that is how local health departments work with the federal government. But it's clear that when it comes down to ensuring the health, making sure that those policies are in place, those protections are in place for the population's health, that belongs to your state and local health departments. So when we are coming to concerns about the way that we work across all three of these levels in governmental public health and making sure that there's smooth connections across all of them, we are really relying at the state and local level. We're relying on the federal government to really set the national agenda, to set the tone, to give us that resources, their time, their expertise, their funding, in order to really implement those policies that are needed at the local level. We are looking to them to set the tone, but the implementation happens at the state and local level. I think one of the quotes that I really look back on a lot to help know where we're supposed to go from here is that the success or failure of any government in a final analysis is with the well-being of its citizens. Nothing is more important to the state than its public health. The state's paramount concern must be the health of its people. And that's really where we need to focus. When we're dealing with the pandemic and trying to figure out what we need to focus on, should it be the economy, should it be health, it's really laid out. FDR says it nicely here, and even the roles and the powers that public health has and is given to us in the Constitution makes it clear that the health of the people is where we really need to focus, and that we need to do that at the state and local level with the support and expertise of those in the federal government. And thank you.